Hey, everybody, welcome back for another episode of Fertility in Focus. Today, we have with us a very special guest. Her name is Dr. Rachele Pojednic. She's the Director of Scientific Research and Education at Restore, which we're going to get into, but it's a place I love to refer to for a variety of things. Dr. Pojednic is an international authority on nutrition, supplementation, and physical activity interventions for muscle physiology, performance, and recovery. She received her PhD from Tufts University Friedman School of Nutrition Science and Policy and completed her postdoctoral training at Harvard Medical School. In addition to serving as Restore's Director of Scientific Research and Education, she has a faculty appointment at Stanford University and holds research appointments at the Institute of Lifestyle Medicine at Harvard Medical School and Edith Cowan University's Nutrition and Health Innovation Research Institute. Welcome, Rachele.
Thank you so much for having me. I'm thrilled to be here.
So one of the reasons why I was so excited to have Dr. Rachele Pojednic on the show is because she's working on backing a lot of what we know is beneficial in this, sort of complementary world with the evidence. She's finding the research and getting out there and really trying to build a good case for a lot of these therapies. And so we're going to dive into, some of the therapies that Dr. Rachele is looking at and what she's found and how we might apply them to fertility. And that might be where I come in. I might say, okay, according to that, we can apply it to the world of fertility for this reason. So let's dive in. How long have you been the Director of Scientific Research at Restore?
Yeah, so I started this position about 2 years ago. Prior to that, I was more traditional academic research. I was a professor in Boston, and then I worked during COVID at a university in Vermont looking at war fighters. And prior to that, I was looking, as you mentioned, at skeletal muscle and healthy aging and longevity. And what I was looking at were supplementation studies. So I started with vitamin D, looking at how vitamin D affects skeletal muscle because we know vitamin D goes well beyond bone. And then I pivoted into CBD and sort of cut my teeth on these two supplements, which are way harder to study than people give them credit for a variety of different reasons. And so that's why Restore called me and they said, you're really great at studying these challenging molecules in a creative way. Would you ever be interested in coming to lead up our new division called Restore Labs to really start to understand exactly what these therapies are doing? Because we know they're working for specific people. We have a limited amount of preliminary data, but we really want to put some backing behind creating a broader evidence base for our therapies. And I was like, hell yeah, let's blow up my career in academia and pivot to industry. I was lucky enough to move to Northern California, and Stanford was also very kind to bring me on their faculty. So I kind of have a foot in both spaces where I stay rooted in sort of traditional academic research and teaching, but apply all of those things into the industry space, which is a really different place to be doing this kind of research.
And it's so wonderful because, being a practitioner of an ancient medicine and knowing of, the benefits so profoundly, what we need is the research and somebody, coming out and really, having that experience and that background and knowing exactly what institutions like Stanford and Harvard and, what the sort of mainstream needs to really take these all seriously.
And it's so interesting that you say that because when I was studying CBD, it was fascinating because I was trying so hard to study this molecule that you can literally get in, cans at the gas station, right? Like anybody can get CBD now, but it was so challenging to study in the traditional space because of a lot of regulatory restrictions around CBD. The molecule is regulated at the state. It's not regulated at the federal level. So getting IRB and ethics approval to actually study it and give it to people in the lab. You can buy it at the gas station, and it literally takes me an act of Congress to be able to give it to people in the lab. And I think that's something that people don't understand about this research is the environment that you need to create in order to be able to study and fund this research is quite challenging. And that's why it was so exciting to go to Restore to say, exactly to your point, we know that these therapies are working, much of them based in ancient tradition. So if you think about cold therapy or hot therapy or light therapy, and what is this data actually saying? When is it helpful? When is it potentially not helpful? And really start to define the protocols, the dosages, and how people can actually utilize these therapies at different stages of life.
This is so fascinating. So I didn't realize that there would be sort of like red tape. I know that's for lack of a better term
Exactly the
around
right term.
actually getting the research done. What do you think the underlying reason for that is?
At the end of the day, the IRB's responsibility is participant safety, right? And so what they really want to make sure is that we are not doing anything that is unethical from a research perspective, which has happened in the nutrition space, right? We have, a pretty good black eye in the nutrition space where long ago we were giving interventions, we were depleting uh, prisoners, so people that had gone to jail. We were working and over supplementing people that were in mental hospitals. So yeah, the face that you're making is
Oh,
absolutely
oh
correct.
God. So you were they well in the history they were depleting people of nutrients to be able
Yeah,
to see how nutrient. Oh God.
yeah.
I
And
mean,
those
but then
kinds
again,
of
like, don't you think a lot of the things that they're conducting tests for, like a lot of pharmaceuticals and things, those are like those would have a fairly, significant impact on test subjects.
Yeah, sure. And the interesting thing is that since they've changed these regulations in the pharmaceutical industry in particular, and we could go down that rabbit hole of the pharmaceuticals that are on the market, but the actual testing protocols are pretty dialed in for the pharmaceutical companies. They have to start in cells, move to animals, and typically that process takes somewhere between 15 and 20 years to bring a drug to market.
Mm.
So yeah, when you talk
Well,
about
that changed.
yeah. When you think about red tape,
Yeah,
it is challenging
yeah.
to do these studies and to do them well and to apply the outcomes to the right population. So here's something that's interesting, right? If you look at pharmaceutical um, therapies, drugs,
Mhm,
they are typically tested for a specific outcome,
mhm,
right? So you give a drug, it is for this specific symptom of Parkinson's disease, or it is for this specific cardiac outcome, this very targeted mechanism. But oftentimes the pharmaceuticals are prescribed off label. And so that's where things start to get a little bit Wild West, if you will, is that this drug, once it's approved by the FDA, can essentially be prescribed for whatever the doctor deems worthy.
mhm,
And so that's where I think a lot of the confusion comes in and the frustration is why are we prescribing these medications kind of willy-nilly? It's because once
mhm.
they're approved, you can.
Hmm. Interesting. I just thought that, things had changed with COVID because obviously the COVID vaccine was rolled out so quickly in an attempt to, save the world, as they say. And then, but then I noticed that thereafter, the RSV vaccine, I don't know if that's been in the works for 15 to 20 years, and that was rolled out.
Yeah, so the technology for the most part has been studied for 10 or 15 years.
Mm,
And I think I don't have the specifics in my in the back of my head as to exactly how it rolled out for the COVID vaccine, the mRNA
mm,
vaccine.
mm.
That particular use case was fast tracked because
Yeah.
the delivery mechanism they thought would be helpful and useful, but the actual delivery mechanism of an mRNA vaccine has been studied for I'd say probably somewhere between 10 and 15 years. They're using it for cancer right now as well.
Really?
Yeah.
The technology, I guess, just in a different way.
That's right. Yeah.
Um,
So the delivery mechanism is, the mRNA itself is different, but
mm,
the actual delivery mechanism is pretty
mm,
standard across the
mm.
different therapies.
This is fascinating. Okay, so where do you think we should start with these therapies? Like Restore, we have IV, vitamin drips, we have hyperbaric oxygen, we have red light. I can tell you that I think what I prescribe mostly to my patients is those three, but I know you also offer cryotherapy and infrared sauna. Um, where would you like to start in terms of where do you think that there's some good evidence and there's been some interesting tidbits for you?
Yeah, for sure. So I think that there's two ways to sort of divide our therapies at
Mhm.
Restore. We've got these core therapies, you called them out, HBOT, cryo, infrared sauna, red light therapy, compression. So those are kind of like external therapy, so from the outside in. And then we've got our IV menu, which is from the inside out, right? So we would infuse somebody. And so what I'd like to do is actually start with those core therapies, because we can come back to the IVs. This is kind of my wheelhouse with supplementation. But the interesting thing about those other therapies, those core therapies, is they all work from a really similar mechanism. So the mechanism is what we call hormesis. So this is going to be a popular buzzword, I think, in the wellness industry and the complementary care industry moving forward, is they all provide a small amount of stress to the body, not too much, not too little. A really good example that I give to people is exercise, right? So when you exercise your body, you do a little bit of damage to your skeletal muscle, you raise your heart rate, you raise your core temperature, your breathing rate consistently rises. And if I were to tell you that without any context, you would say, that seems like a dumb idea. Let's not do all of those things to my body. But in reality, what's happening is by stressing your body out just a little, not too much, it provides opportunity for your body to respond. And in many cases with these therapies, essentially overcompensate so that you become stronger on the other side, or that you have these beneficial physiologic outcomes. And so when we're thinking about these therapies, HBOT, there's a specific mechanism with oxygen. When we think about red light therapy or photobiomodulation, there's a specific wavelength with which we are using in order to induce this hormetic effect. Heat with infrared sauna, compression, we're actually physically moving the body, right? And so let's start there and talk about those therapies, because I think that this is where we can really start to think about how they could potentially affect fertility, women's health, and women's health through the aging process.
Love it.
All right, so tell me your favorite. What's your favorite therapy that you send people for?
I would honestly say I found a small study on the hyperbaric oxygen, and it was done on a small group of women going through IVF, and I actually did a podcast episode on this because I just didn't really see a downside to engaging in the therapy, as long as you're the nurse, whoever it is at Restore, didn't see any conflict, right? Because you have somebody do the assessment when they go there. And what was found was that if women did an HBOT session every day for the 10 days that they're injecting stimulants, like the medications that stimulate their ovaries, that it actually led to better IVF outcomes. That they had better quality embryos, for example, which is really, like, I would say the biggest battle is egg quality. There was a book on egg quality that just blew up because that seems to be the thing that doctors are often like, it's your egg quality. And whether it's bad because you have PCOS or because you're aging, like, sorry, nothing you can do. Whereas my view is these therapies are actually an amazing intervention because of their ability to increase that cellular energy in the mitochondria and bring a lot of like cell turnover and renewal, basically. But I definitely want to hear your take on what exactly does HBOT do?
Yeah. So HBOT is a great place to start. And honestly, it's probably the most impactful therapy that we have. The interesting thing about HBOT, as well as all of these therapies, is consistency is key. So to your point, with this study, they did 10 days in a row. And when we look at some of the clinical trials, and there's a significant amount of clinical data on HBOT, looking at wound healing, looking at different types of therapies, from cancer to arthritis, all these different therapies. And the reason that it works, to your point, is it provides this really potent regenerative capacity to the cells. And so the way that it does this is twofold. So the first was kind of obvious, is we're just pumping a bunch more oxygen into the system, and the body can utilize this oxygen as a precursor essentially to aerobic metabolism, which is going to create more ATP, more energy in the system, which is great. We want more energy. However, The real magic is actually not in the sense that we are pumping more oxygen in necessarily, but where we are pumping it. So if you've been to the doctor recently and they put that little red meter on your finger and they test how well oxygenated your blood is. If you're a healthy human, it's going to be somewhere between 97 and 100% saturated. There's not much more that we could do to attach more oxygen to those red blood cells. But a place that we can put it is into the serum of your blood. So we essentially oversaturate that blood. We dissolve that oxygen into the serum for short periods of time. So when you get HBOT, it oversaturates during the time that you're in the chamber. So usually about an hour or 90 minutes. And then it lasts probably about 20 minutes to 30 minutes after. And then it disassociates and it goes away. But during that time, when it is in your blood, what it does is essentially creates this hormetic effect where your body is like, wait a minute, there is oxygen in places that it should not be in my body. And so what it does is it tries to overcompensate to make sure that nothing goes wrong with that oxygen. So oxygen is a very reactive molecule in the body. And you've heard of reactive oxygen species, right? These are the potent inflammation markers that cause damage to your DNA and to other tissues throughout the system. And so what your body will do is it will start to overcompensate with antioxidants, right? So it starts to, I hate to use this word. I hate this word so much. My marketing team uses it all the time. It actually does boost your antioxidant production for this short period of time, which can do really good things in the short period, right? So you've got this antioxidant capacity, likely glutathione and a couple of other molecules that we know are antioxidants in your system. And they can go and clean up anything that's damaged because you've got essentially a larger concentration of them in your system. What we're also noticing with HBOT, which is really fascinating, is that it starts to increase, as you called, cell turnover, right? It increases these mechanisms to enhance cell growth and then potentially enhance cell growth in interesting places like red blood cells, like the stem cells that are precursors to all of the tissues in our body. And so now you've got this really powerful combination effect of antioxidants, cellular growth, cellular turnover, because you've got these antioxidants that are getting rid of the damaged tissues. And we're also seeing this angiogenesis, this increase in blood flow. So one of the most powerful studies that have been done on fertility in HBOT is actually in men. And they have actually shown in several clinical studies that they can improve erectile dysfunction in men, which is a vascular disease. And so by improving this angiogenesis and the blood flow, you can reduce that erectile dysfunction. So definitely something going on in this reproductive space and likely also in the female space. So when we think about eggs, there's been some really great studies in animals, right, that are using HBOT to show improvements in oocytes, right, that help to improve the fertility of these animals, as well as perfusion into these reproductive organs, which are obviously going to be really helpful. So yeah, there's a lot going on with HBOT that I think we're only just scratching the surface with.
So that was an amazing answer. And I love that this is an action item for men. Come on, men.
Yeah, come on, man. Get yourself in the
Participate in
chamber.
making this baby.
Mm-hmm.
And I honestly think that HBOT for a man is an easier sell than say coming to acupuncture or something. You know, because acupuncture does a lot of things too. It increases the blood flow and boosts the I know you hate that word, boosts the antioxidant capacity and helps for the cell turnover and what have you. It just basically catalyzes healing and assists in the function of all your organs.
Yeah.
But men don't like the idea of being poked a lot of the time unless they have, a sore shoulder or something. But I feel like they could get down with getting inside a big oxygenated bag and playing on their phone for a little while.
Totally. And that's the thing. The other thing that I love about HBOT, which is just a beautiful side benefit, is you get 60 to 90 minutes where nobody can bug you, right?
Totally.
Like if you're like, I'm going in the chamber, I'm not bringing my phone, I'm going to bring a book or I'm going to take a nap, it's how beneficial is just that time for yourself that's quiet, that's thoughtful, that's meditative, or, bring your phone in and watch the game, whatever you want to do, man. But, I just feel like that is also something that's so lacking in our day to day that can be an added benefit to HBOT.
Oh, absolutely. And because I'm in New York with a very type A population that doesn't like to waste any minutes, that's how I tell it. I'm like, but don't worry. Like you're gonna go in there and you're still gonna be able to like do your
Yep.
work. Some of my
You can
patients
do
are even
everything.
taking conference calls from inside. So I think that's fantastic. It's just to note that. And for anybody who doesn't understand the term oocytes, it is your egg quality. It is that thing that that we're so heavily focused on. And so you might want to try it during a cycle or in preparation for a cycle. Just experiment with it. It's a nice thing about Restore is that you can just try out some of the therapies.
That's a really good point too, is one thing that we don't know is like when in the cycle is the best time to be doing these therapies, particularly something like HBOT. I would love to, maybe we can collaborate on a study at some point. I would love to think
Love
about
it.
when is the most beneficial time to be having this effect on the body. When we look at the clinical data, we see that a lot of the protocols are very extended, but these aren't for specific outcomes. These are
Mhm.
for more longevity type outcomes or reductions in inflammation, reductions in cardiovascular disease risk. And typically what we see is that they're 5 days on, 2 days off for somewhere around 60 days total.
Mhm.
But one of the things that we don't know about this therapy yet is, what is the benefit of 5 days and then nothing in a very targeted space? So, this is something that I really am interested in when we think about Restore and what we can use Restore Labs for is how can we create these really tight protocols for people that are looking for a very specific outcome.
Well, I will say, the thing with working on fertility is that, like, a lot of the research says you have to do it for 3 months, 6 months. And this book that came out, like, it's about the egg that everybody kind of clings to for information on this. It's like, okay, you got to take it for at least 3 months. First of all, a lot of the supplements I've seen not do much in 3 months, more like 6 months to a year, actually. I've seen the same be the case for certain therapies, depending on what my patients are getting ready for. If we're preparing their uterus, we can get a lot of short-term benefits. If we're preparing the eggs, it really depends on if it's an aging thing or a PCOS thing. Like what's the root of the issue? I will say that I think I've noticed a difference clinically with prescribing the HBOT in short periods of time, because when people come to me, I'm like, okay, if you've come to me just right before you're starting the IVF cycle, we don't have a ton of time. So
Mhm.
this is one of the therapies I often prescribe, because I say, we're going to put it all in at this time, everything that could have a benefit in the short term, even though we don't have enough evidence, and where there definitely isn't a downside to it. And where I see that they come out and over the days of them doing it, their skin looks better, energy, so it's like, why wouldn't that be having a deeper effect within the body, inside out, right?
Certainly. And I think a really important point that you're bringing up is safety as well.
Mhm. Yeah.
So when we look at the HBOT machines that you come to at Restore or any of the other commercially available, in studio HBOTs, these are actually not medical grade HBOTs. And this is really important because it provides a level of safety that is, really critical if we're working with somebody that is in a stage of, just getting prior to IVF, is that what we're doing is we're putting somebody into the chamber at 100% oxygen. So you put the cannula up your nose when you're in the chamber, and we pressurize to 1.3 to 1.5 atmospheres of pressure. When you go to the doctors, or you go to the hospital, if it's somebody that is being, it's wound care, it's they've got cancer or they've got something that they need to, the bends, they've come from a diving accident, that is pressurized up somewhere above 1.5 and usually above 2.0 atmospheres. So in that case, that dose is going to be significantly greater. And I say this because what you can do with these therapies at Restore or studios like it is you can go into these places and know that these are safe therapies to use, that you're not going to overdo it. So remember when I talked about hormesis, just enough stress, but not too much.
Yeah.
You don't want to be taking a cannon to a problem if you don't need to. You want to be taking, a scalpel to the issue so that you actually really target it. And that's something that I really like about these grade of chambers, is that they're pretty safe for almost anybody that can actually make it into the chamber itself. So that's the part that I really love about it. If you think about it from a safety perspective, I could tell you some therapies that I'm like, you really want to be careful about overdoing it. But this
Yeah.
one seems to be that consistency is really great and the safety protocols are pretty awesome.
Yeah, and that's one of the reasons why I like it. I just, we all take an oath, everybody who practices any form of medicine, whether, they're on my side or the other side, it's to do no harm, right?
Exactly.
So the one would hope that, even if you're, a really like somebody who thinks outside the box and is suggesting these therapies that don't maybe have, as much evidence backing them as we want them to, at least they won't do harm, and I think that's one of the reasons why doctors like acupuncture a lot, because they're like, well, if you're going to do it, at least it's not one that could cause harm.
100%.
So let's move on to red light therapy, because this is another one that I love. And actually, some research came out in my community, the American Board of Oriental Reproductive Medicine. There's a couple people really at the forefront of research in my community, not many. So again, anybody who's making effort
Join
in this
these
department,
forces.
yeah, like go, Rachel, go. What was found, there was a couple studies. I think one was in Japan, that if you use red light therapy over your throat, it actually improved the function of the ovaries. And then there was another one that if you put it over your sacral area, your lower back, and this is, I think, used more over the course of 3 months, a few times a week for 20 minutes, then that was improving IVF cycles. So again, this being a therapy that I'm not worried about there being a downside to, and in fact, it helps with athletic recovery and anti-aging of the skin, hair growth. You're going to tell us more about the benefits, but this is another one that I often prescribe to just like try to boost or bolster results in a shorter period of time.
Yeah, that's exactly right. So red light therapy is from a family we call photobiomodulation. So that's the scientific term for this. And photobiomodulation can run the gamut of all different types of wavelengths. When we look at red light therapy, this is a wavelength that is typically between, I think it's 400 and 600 nanometers. And so this is visible red light. You could also see in some of the panels, they have far infrared, or in some cases, they've got a little bit of infrared as well. That's non-visible light. Those you will get in abundance if you go into an infrared sauna. But let's stick with red light for now. So when you look at the red light therapy, this has been used, as you pointed out, in skin research and in wound healing for probably decades at this point, right? And they recognize that if you put a very specific, mostly laser therapy onto the skin, really targeted, then you can help with wound healing, you can help with scar removal, you can really improve the consistency and the texture of the skin, anti-aging, as you mentioned, wrinkles start to go away, which is why these therapies have become really popular. You see all these Instagram ads with those crazy masks, right, that everybody's using. I will say that dose and intensity of the light really matters. So we should talk about that and why it's really wise to come into the studio rather than using the at-home devices. But what we do see is that this red light penetrates the skin. It doesn't go deep into the body. Infrared sauna will go very deep into the system and it heats essentially from the inside out. But one thing that's really great about red light therapy is that it has a direct effect on your mitochondria. So again, right back to what we were just talking about with HBOT, is it's going to improve the ability of that mitochondria to produce ATP. Great, we've got more energy. This is going to be terrific. The cell needs more energy to do all of its things. That's wonderful. But the other thing that it does, which is really interesting, is it works on a particular part of that mitochondria in addition to help reduce those reactive oxygen species again. So when you create energy in your system, just naturally by the process of metabolism, your body produces reactive oxygen species through your mitochondria. And it's suspected that in some cases, in some people's research, that the majority of our reactive oxygen species that are internally generated are going to come from your mitochondria, just as a very natural byproduct of metabolism. So what red light therapy does is it not only helps your body use its mitochondria more efficiently, to produce ATP, but it also helps to reduce the byproducts that can be potentially detrimental, these reactive oxygen species. There's also some data to show that it improves the number or the density of the mitochondria in the cell as well. So now you're sort of hitting at it from three angles. Your mitochondria are more efficient, you're producing less reactive oxygen species, and you're making more mitochondria. So all of these things are going to work in synergy. Zoom that out, and what you've got is a healthier, more efficient cell, right? And so once that starts to generate through your system, we're creating these antioxidants, reducing the reactive oxygen species. We know that those are so detrimental to nearby and neighboring cells. It reduces the burden sort of all over the body.
So well said, because it's really like a lot of the messaging in the world of fertility is about the mitochondria, is about regeneration of the cells and energizing of the cells. Like for example, CoQ10, coenzyme Q10, was one of the I would say more well-studied supplements for improving egg and embryo quality, and it's all about the mitochondria of the cell. Now, what I often say is if we can do this via a different method, this is a good thing, because what happens with fertility, and I think in general this can happen, is that, and I'm a fan of supplements, by the way, I have my own regime, but sometimes we can start taking so many things orally, and our body has to process that in a
Yes.
certain way, that it's nice to get it via a different method of administration and a different, like, and you're kind of boosting the body's ability to do it itself.
That's exactly right. And that's what this whole idea of hormesis is, right? Challenge your body just a little bit so it does it itself.
Mm-hmm.
And we know that with consistent use is like your muscles, with consistent exercise is going to be really beneficial for the long term. It's not just that one time that you're taking the supplement where you're getting that, increase in concentration in your system. In this case, what you're doing is you're training your body to be more efficient and more effective.
So great. I'm so
So
excited for
cool.
the interview. Okay. So the next one I wanted, because I know we were gonna cover some of those, and I do
Oh
want
wait,
to talk a little bit.
before we move on really quickly,
Yeah.
one of the other really interesting lines, and again, this goes, it takes two people to make a baby, right? And so one of the other things that we're seeing in red light therapy is potentially also improvement in sperm. So something to think about. So I wanted to double tap into this really quickly about the intensity of the light. So when you come into a Restore or, one of our competitor studios, they have these big panels that you
No, we're
stand.
going to Restore.
Yeah, we're
Restore is
going to Restore. Okay. We're going to Restore. When you go to Restore, you're going to be standing in four. So essentially it's 8 panels, 4 on either side of you. You get naked, you strip yourself down, and you stand in front of these panels for 10 to 12 minutes. What we use is these very powerful. Remember I told you that they started to use photobiomodulation red light with lasers. So
Mhm.
lasers are a very, very tiny, very concentrated beam of light. They're still more concentrated than the LED lights that we use. However, the LED lights that we use at Restore are at such a significantly higher concentration of light. You're going to see that benefit in a really different way than the battery powered ones that you might get at home on the face masks, or the ones that you can put on a specific spot, if you're recovering from shoulder injury or knee pain or whatever. So the benefit of that is now you're getting it all over your system. If you're naked, you're going to kind of get it all over in those spaces that are housing essential organs, sperm potentially, and you're getting the benefit at the concentration that we are pretty sure works. So that's really helpful.
And is it like, I know there are different, like, I don't know if it's wavelengths, but there's like far infrared, near. Tell me about those a little bit.
Yep. So
What
when
are
you
what should people be choosing?
Yeah. So when you look at the infrared, when you look at the photobiomodulation spectrum, right? So this is going to be using light therapy or just outside the visible spectrum in order to penetrate that wavelength of light is going to penetrate your system. The penetration, the smaller that UV, or excuse me, the smaller the wavelength is going to be is going to be a more shallow penetration in your system. So when you look at red light, that is going to be sort of like very shallow into your system. When you look at near and far infrared and infrared light. Again, these are the things that you would come into contact with in an infrared sauna. These are going to go significantly deeper. It's unclear right now if they're having the same mechanism of action on the mitochondria, on the internal organs, mostly because it's just hard to study. Like you can't take a biopsy of your liver while you're getting infrared sauna.
Good point.
So it's challenging to do these actual studies. So it's likely that these things are happening. But the other thing that happens with infrared that's different than red light is it really heats you up from the inside out. So if you've ever been in an infrared sauna, it's really interesting. You get into it and it's warm, right? It's pretty warm, but it's not like a Finnish sauna. If you've ever been in a dry sauna, you go to these places and they've got these beautiful wood saunas. You get in there and it's like, whoa, it is so hot. When you get in an infrared sauna, it essentially, those light waves, those wavelengths of light, which are a little bit longer than the red light, are going to penetrate deeply into your system and essentially cause your core temperature to rise. That's the main outcome that happens with these. So again, slightly different mechanism, but I would encourage you to use both. I think they're both really, really beneficial, and heat is a really interesting therapy in and of itself.
I agree, but here's the caveat with the infrared sauna, which is why I didn't choose it as one of the main therapies that I recommend. So one, infrared sauna for men, the thing that they're recommended to not do in preparation to give sperm for a cycle or in getting pregnant is to raise their body temperature, because it kills off sperm. So it wouldn't be my favorite thing for the men to use, even though it would be great on the detoxification side. And that I would say is a major benefit. And I think you mentioned that you're conducting a study on firemen who have higher cancer rates. And so, that on its own is very compelling. For women, on the other hand, I do think the infrared sauna could be beneficial. However, I worry about a lot of toxic dumping in preparation for a cycle. So like in a short period of time. However, I often prescribe it after they do an IVF cycle to get all of the crap out of their system. So I'm not sure if you have any comments on that in terms of it just for detoxification, or if there's really something else that you would recommend it for.
Yeah, so this is actually really fascinating, and I'm working with a collaborator on this as well. What we're doing is, in preparation for this potential firefighter study, we're actually trying to figure out, and I'm working with a couple of different labs on this, exactly what the load of toxins is that comes out in your sweat, right? So we've got some pretty good data to show that when you sweat out, things like some of the more classic studies are done in men that work in mines that get exposure to heavy metals, right? So if you take those folks that have a very high burden of heavy metals and you make them sweat, you can see the heavy metals in their sweat. It actually shows up. The question that we're asking right now, and you just pointed out to it so perfectly, this idea of like detoxification dumping, is how much actually is in your sweat, and more importantly, how much does it actually pull out of your system? So the collaborator that I'm working on right now is doing this beautiful study looking at heating people up to a very high temperature and then looking at their sweat, looking at their blood, and looking at their urine to make this correlation between, okay, if you've got this much, heavy metal toxins, whatever, PFAS that are in your sweat, this is how much we believe it pulled out of your blood. So it's not necessarily a one-to-one correlation, we don't think. And the question is, this goes to dose as well, is 10 minutes in the infrared sauna long enough? What about 30? What about 60? How long do you actually need to be in order to truly see the load of toxins in your system go down? So I'm so excited about this study and this series of studies because we know that sweat is detoxifying. The question is how detoxifying. And once we can define that, then we can define some really targeted protocols, exactly what you're talking about. This is when you should use this therapy. This is when you should not use this therapy. And so I'm just super excited about figuring this out at such a granular level.
Yeah, I mean, the magic is going to be so much in the details to develop those protocols that really will have just such a higher ROI
Yeah.
when they're executed in that way with the specificity. So I'm excited for you to be doing it too.
Same. I'll give you a really good example of one that we've discovered lately that I think is relevant. It's not relevant to fertility specifically, but this idea of when to use a therapy and when not to use a therapy.
Mm-hmm.
So cryotherapy, cold therapy on the other side of heat. For the longest time, we were using ice and cryotherapy, like getting into an ice bath or getting into a cold plunge or using a cryotherapy chamber for athletic recovery, right? And what we've actually discovered, my lab as well as several other labs all over the world have discovered, is that if you get into that ice bath or cryotherapy chamber immediately after exercise, it actually impairs all of the work that you have just done, because what ice does, different than the heat therapies, is it vasoconstricts all of your blood vessels. So
Mm-hmm.
now you've got a damaged muscle tissue that's screaming to the immune system, I'm broken, I'm damaged, I'm broken, I'm damaged, come fix me. I get into a cold plunge, I vasoconstrict, and I essentially block that signal between the muscle and the immune system, because we want an immune response after
Yeah.
exercise to come rebuild the tissue.
Mm-hmm.
So now, oh shoot, we've been doing it wrong this whole time, right? We should be doing cold therapies. It does some really cool things, but you don't want to be doing it around your athletic event, which is what we've been prescribing it as this whole time. Theoretically, it made sense. Let's reduce inflammation. And then we're like, oh, shoot, we actually don't want to reduce inflammation in this very targeted period of time, because it blunts the effect we were looking for in the long term. So this is the stuff that I'm really excited
Wow.
about figuring out, is timing, dose, the population. When should we be using this in a really sort of clinically meaningful way?
Absolutely. Oh my gosh, that's so interesting. And it makes perfect sense.
Makes perfect sense, right? Yeah, totally.
So before we finish up, I'd love to touch on the IV therapies. And one of the ones that's more popular in the fertility world right now is NAD.
Yeah.
So if you don't mind kind of, giving us your high level opinion and insight on that, that would be wonderful.
Yes, you are hitting me at a perfect moment for this. We actually just completed, and I'm writing up the manuscript right now, a study on NAD. This is specifically for the general healthy population, right? So not specific to fertility at all, but I can give you the sort of high level on this. What we did was we've been offering NAD at Restore for, since the day that we started our IV micronutrient therapies. And it's used fairly widely in the sort of like biohacker space, in the complementary space. And so what we did was we wanted to figure out, okay, exactly what is NAD, the injectable form, doing? Right now, if you go to PubMed and Google NAD intravenous, there is one study on intravenous NAD. Yeah.
Wow.
And so when I first got, and it was a safety study, it basically showed NAD is perfectly safe. But there's a caveat to this, so I'm going to come back to it. And so when I first got to Restore, I was like, what is this molecule? It's a B vitamin derivative. It's a niacin derivative molecule. It's super important for all of the things that we've been talking about, metabolism. Essentially, what NAD does is it is a redox molecule, which means it shuttles around a hydrogen. Specifically in metabolism, think back to ninth grade biology. You'll remember that the Krebs cycle is that sort of intermediate space in metabolism, and there's these NAD molecules that come in, they pick up a hydrogen, they bring it to the mitochondria, that hydrogen gets dropped off into the mitochondria, and there's this gradient that happens throughout the mitochondria where by the end, you end up with ATP. But shuttling that hydrogen is critically important. And what we know about NAD is that it becomes deficient, or you become deficient over time. So with aging, naturally you stop producing NAD. Now, natural way that you can do it is you can take niacin pills, right? You can't actually take an NAD pill. It gets degraded before it gets absorbed. So this is why we inject it. Now, here's
Everybody's taking NAD pills in the fertility world right now.
yeah,
And
so
I
they
keep
can
getting
take.
asked about it, and I'm like, it's not one that I usually prescribe.
I have
Uh,
a solution. I have a
okay.
solution for you.
Okay. All right.
So NAD is one of the molecules that is derived from niacin, E3, right? So NAD is one. There are others, NAM, NR, and NMN. All of those you can take in oral forms because they're just sort of naturally occurring in your food anyways, and your body will recognize them and absorb them and use them. I'm going to come back to that in just a second. So we did this study where we're trying to understand, what is NAD actually doing? In the meantime, I call up one of the leading experts of NAD in the entire world. His name is Charlie Brenner. He's down in Southern California. And he said, Rachel, what I need you to do is I need you to look at this new injectable, NR. So when we look at NAD, remember I told you that it was a part of metabolism, a part of the Krebs cycle. NAD is supposed to exist inside your cell, right? It's in the cytoplasm. Have you ever had any of your clients go and do the NAD injectable before?
Yes.
What is their experience like when they go and get their NAD infusion?
It's funny. I haven't had
Have they
anybody really
described?
comment on it that much.
Okay.
You tell me.
Yeah.
Maybe
When
because
you
I'm
get
covering so many other things with them that I didn't get the scoop on NAD specifically.
Yeah. So for the vast majority of people, when you get an NAD infusion, you actually feel this like pretty significant like chest. Like it kind of feels like they say it feels like an elephant is sitting on my chest.
Oh, whoa.
That's kind of like minimal side effects during the infusion, during the drip. Other people, massive GI distress. You feel like the worst car sickness you've ever had in your life. And the most extreme is people get immediate diarrhea.
Oh
Seen
my
it
God.
happen in the studio all the time. It
Wow.
takes people somewhere between 2 to 4 hours to do the injection because it's so miserable. Back to Charlie Brenner. He says, Rachel, do your NAD study, but also I want you to look at a new NR injectable.
Yeah.
NR, you'll remember I told you, is a derivative of B vitamin, niacin, very recognized in your system because it is part of your food. So we did this study and we put NAD, we had half people got NAD, half the people got NR. People that got NAD, exactly as we expected. Chest pain, they were in the chair for 2 to 4 hours. Afterwards, they felt amazing, right? Really great. Everything was terrific. But during that infusion, misery. NR, no misery. A little bit of flushing, a little bit of jaw tingling, which comes with, if you take a niacin injectable, same thing happens. If you take an oral niacin, you can get flushing. And so we were like, that's interesting. What's going on here? So I called up Charlie and I was like, okay, exactly what you said was going to happen happened. Why? And he said, Rachel, go back to the pathway. And I was like, NAD exists in the cell. When we put it into people's bloodstream, the body was like, what is happening? This is supposed to be in the cell. Essentially, the immune system was like, why are all of these cells lysing and exploding and releasing NAD into the serum? And you just have this massive immune response, right? Chest pain, nausea, vomiting, diarrhea. NR, because it is the molecule that is recognized by the body, exists beautifully in the bloodstream, so you don't have that effect. Then the next step of the process comes in. When you look at the cell itself, you remember I told you that NAD exists in the cell. There's no transporter to get NAD from the outside of the cell into the cell. It has to get converted into another molecule before it gets into the cell. Guess what it gets converted to before it gets absorbed?
NR.
NR. You got
Okay,
it.
so you're skipping that whole conversion.
Skipping the middleman. We are
It's
skipping
like
the middleman.
folate and methylfolate kind of thing.
Exactly.
Yeah.
Yes.
Okay.
So when we look at the NR injectable, not only could we put it straight into the bloodstream without discomfort, but it can get directly absorbed into the cell. And what we and the companies that we've been working with are showing is that actually increases NAD intracellularly, which is where you want it, by even higher amounts. So to your listeners, what I would say is NAD works. Eventually it will get converted and it will get absorbed. NR works better, particularly when we're talking about an injectable. And when we're talking about an oral, There's no good data to show that NAD gets absorbed through the GI tract, but NR will. So I would say on average, you want to be leaning toward the NR orals and the NR injectables.
That's a great tidbit because I have been asked this question about the NAD, and some of my patients, they self-prescribed it from somewhere else, right? And I haven't really seen any, like clinically have not observed any improvement in outcomes. Granted, generally the people going through all of this are doing multiple things at once. Have you seen any benefit of any particular nutrient that could be done via IV for reproductive health or the fertility space, either male or female?
Yeah, so there's really limited data on injectables. There's a
Yeah.
lot of good data on orals, which
Hmm.
if
It's
we come
true.
back to my origin story at Restore, they brought me in
Mhm.
because I'm a supplement researcher and I thought that I was going to be drilling down into all of our IV micronutrients. And I've kind of gotten sidetracked with some of our other therapies, but NAD is kind of my first foray back into our injectables.
Mhm.
The one thing that I'll say is that on average, again, the thing that I am really, really, really adamant about is that the therapies seem to be quite safe, right? So I
Yeah.
think that again is a really important element here. As far as what might be potentially beneficial for fertility specifically, you can always go to the antioxidants, the ones that
Hmm.
we've been talking about that are going to be produced naturally during use of HBOT and red light therapy. So in our menu, things like vitamin C, things like glutathione could potentially be quite helpful.
That's so
Um,
funny. When people show me the menu, I'm like vitamin C and glutathione. So I think most of my patients have actually been going for that. It was a fertility doctor that in his presentation mentioned IV via injection, but he didn't qualify what the experience might be for the patient, which is kind of a big deal.
Yeah. So
Yeah.
I think that what I will say is there is no other ingredient on our menu that has the negative side effects or
Mm.
negative experience that NAD does.
Mm.
So when you get a vitamin C or a glutathione drip, I mean, you can fall asleep in the chair, you can take a nap, and then afterwards you're sort of like perked up like a little plant, right? Because you've
Mm.
got your saline on board, you're rehydrated really well, and then you've got this dose of these micronutrients. The next ones down the line that I would probably point people to are a B complex, right?
Mhm.
So again, this is going to be all those really important precursor molecules to metabolism, which we want to be enhancing during times of, trying to manage fertility. And then something like magnesium could also potentially be helpful, not necessarily because of the effects on fertility itself, but remember, and I'm sure you talk to your patients about this all of the time, is that if people are trying to get pregnant, they're really stressed out and they're super
Yeah.
focused on, being able or not being able to get pregnant. One thing that magnesium is really nice for, it's got this really beautiful relaxation effect and it's also
Mhm.
helps people sleep.
Yeah.
So it could be one of those that kind of like that 90 minutes in HBOT where you just get that infusion, you take a little nap, you have a little calming effect, and that night you just sleep like a baby.
I love that you say that because there was actually, I looked at the research on magnesium for one of my episodes, and there was something that came about. And again, it's just not a ton. So, I share what I can find, but higher levels of magnesium in the follicular fluid could lead to improved egg quality in women after the age of 35. And
Mm.
maybe part of that is due to just its relaxing effect. I'm sure it has many other benefits, but there's so much out there for us and so much to look at. And so we're so excited to have you here to provide us this high level take, on really the evidence behind it. Dr. Rachel Pojednic, thank you so much for being with us today. Where can our listeners find you and follow the amazing work that you're doing?
Well, thank you so much for having me. I really appreciate it. If you are looking for me on the socials, I am at Rachel Pojednic, so first name and last name. My website is rachelpojednic.com. And then I also have a nutrition education platform called strongprocess.com. So you can find more helpful information about basics for nutrition, for performance, and maybe we'll have to add a module for fertility and for helpful tips and tricks for people that are trying to get pregnant. That would be a really interesting one we could collaborate on.
I know that we would love that.